Hi, my name is Chris Costa. I'm a board-certified plastic surgeon here in Las Vegas, Nevada from Platinum Plastic Surgery, and today we are talking about BBLs. Common question is, how long will my results last? The nature of this procedure is we are taking your living fat cells and we are transferring them to another part of your body, and then those fat cells are incorporating into that new tissue and just live there. So the answer to how long your results will last are really how long will those cells survive, which should be like indefinitely, depending on how you age and how stable your weight is. Do you gain weight? Do you lose weight? So the results should be relatively permanent. However, there will be a phase where in the beginning you will lose some of that volume because some of those fat cells won't survive. Some of your initial result that you see right after surgery is going to be related to just swelling, inflammation, fluid that was used to inject the fat that is obviously going to go away with time. So once those fat cells do survive after, let's say, 6 weeks, they usually don't go anywhere. So a lot of your long-term result is almost more dependent on just how you age, changes in your weight, and the integrity of your skin laxity. What steps can you do to make sure that you get the best result possible? Every doctor is going to have their own unique recommendations, so I highly recommend that you follow those guidelines because in their hands, that's what's going to give you the best result for their surgery. Things that I think that you can do that will help with your recovery after a BBL are, number one, no sitting on the butt. I say about 3 weeks hard no sitting. Between 3 and 6 weeks, you can do about 30 minutes as long as it's with a BBL pillow to offload pressure from the butt. And other than that, first 3 weeks, I think it's a great idea to just keep your heart rate down. Don't do anything that's going to stress you out. Keep inflammation down. I highly recommend taking supplements like arnica, prescription NSAIDs to keep inflammation down. I think that does help a little bit with just decreasing inflammation to help get as much fat survival as possible. A lot of this is anecdotal, and the reality that I tell my patients is you're going to lose realistically about 1/3 of whatever is placed because 1/3 of those cells will likely just not survive just because all of those fat transferred cells need to grow new little blood vessels to get nutrients and oxygen, and if they don't do that, they won't survive long term. Something everybody wants to know is surgery painful? What's the recovery like? It's very variable for everyone. What I've noticed with patients is the first 24 hours can be kind of tough, sometimes up to 48 hours, and then it's like a switch just kind of switches and things start improving that way. The actual fat transfer to the butt itself, most patients say they don't really have any pain with that at all, so that's usually not an issue. It's really mostly related to the liposuction. If you think of areas where getting a tattoo is kind of rough, those are the areas that people tend to say hurt the most, around the rib cage, that kind of thing. In my patients that are looking for definitely more high-def results, they tend to be sore for about a solid 24 hours longer than a standard liposuction patient would be. Standard liposuction, maybe back to work in about 2 to 3 days. High-def patients, maybe more 4 to 5. In terms of scarring, all of our incisions are very, very small, about 3 to 4 millimeters, about the width of your pinky nail. They're hidden in places that are most inconspicuous, so that way if you are wearing a bikini, that those incisions aren't going to be super, super noticeable. However, I can say that it will depend a lot on your skin texture and the tone of your skin, because darker skin types will be more likely to show any incision no matter where you hide it. There can always be some internal scarring called fibrosis from liposuction, which is one of the risks of liposuction that we always talk to patients about. Alright guys, thanks for watching our video. If you have more questions about this procedure or any of the surgeries I perform, check out my website, drcosta.com. We'll put a link in the description below. If you like this video, please like and subscribe. We're trying to produce a lot of these to get the public more information about plastic surgery.